Thank you very much, and we want to start as well by saying what a fantastic conference this has been. A number of us have been to multiple conferences, and we really have learned a lot from the experiences, the insights, and the knowledge that you've gained in your efforts to create integrated care. There are more than 40 Canadians at this conference, the most who've ever attended, and we face huge challenges trying to create integrated care opportunities and systems that work. We need to learn from you, and so we're launching the first North American Conference on Integrated Care to bring this experience, this knowledge to Canada, to really share with our colleagues, our friends, our system, as we face these huge challenges moving forward. And we want to invite you to come to Toronto to learn from what we've done and to share your lessons with us moving forward. Thank you.
And I'll just say that from Canada's perspective, after we've been to Australia and after you've been to Croatia, we're looking for you to come to Canada. In Canada, and actually across North America, we have many isolated health systems. Many of those, in fact, most of those health systems are also working towards integrated care models. And this is particularly true in Ontario, Canada. But we really haven't done a very good job of learning from each other. We've been coming overseas to many of these conferences over the years, as Ross mentioned, and we've learned a lot from the international examples. And congratulations to the many Canadians that are here this time learning. In particular, congratulations to Jacoby on the Best Poster Award there. The North American Conference on Integrated Care will be a catalyst for this comparative learning across North America and internationally. And we're really eagerly looking forward to welcoming researchers, organizational leaders, clinicians, and other care providers, and particularly patients and caregivers to Toronto in October 2020.
Hello, everybody. I am part of the team with the University of Toronto, KPMG, and the Change Foundation to bring the first North American conference of ICIC. ICIC has started a social movement, a movement where 60 countries around the world are coming together to learn from each other so we can realize the potential of integrated care. In North America, we are no different, and we want to connect up those that are interested in, believe in, and who are doing integrated care within North America with the rest of the world. And we are so excited to bring 60 countries to North America, but also to work within Canada and across the United States to learn from each other. And we're doing this from the lens of co-creation. Following on IFIC Ireland's good example when they hosted the conference, patients included designation was achieved. We have the same, which means patients, users, clients, and their families are co-creating the priorities for the conference, will be co-delivering and co-planning the conference, and will be co-attending the conference. In addition to us as partners, we have many other partners across Canada and the United States that we're going to work with. Many of them are in the room today. Accreditation Canada and Health Service Organization, the University of Waterloo and the Canadian Frailty Network, St. Joseph's Health System in Hamilton in Ontario, and the University Health Network. And there are others, so if I didn't mention you, I apologize. But our idea is this is about all of us, for all of us, and with all of us, co-created by people and their families. So we hope you will join, and we'd like to introduce a video to tell you a little bit about this work. Hi, I'm Jodeme. We are hosting the first conference of the International Foundation for Integrated Care in North America. We are so excited. Come with me to meet our partners and learn why. Nice to see you. Come sit. What's so great about bringing the first conference to North America?
It's going to be a super opportunity for the international community to see that Ontario really is innovating in integrated care. The research is an excellent partnership with providers and policymakers to learn about implementation and to understand with rigor what works and where and for whom.
focus on integration from a policy perspective. Tell us why that's important to you.
The way that we at KPMG really think about this when we're working around the world is how do you activate citizens, consumers, patients, and their caregivers to play a meaningful role in the design of health and social care systems so that it works for them.
I'm going to sit there. Tell me about your role in the conference.
One is I have like a nursing perspective, and I can bring kind of my health professional role, and also as a patient, having a brain injury, having struggles in the healthcare system, and not having the resources available to me.
For me, as a caregiver, I would like to contribute my caregiver experiences and what is lacking, what need to improve. I'm a cancer survivor. I also can share some of the insight as a patient.
Jodeme, how are you feeling after that conversation?
Emotional. I'm reminded all the time why we cannot advance any change in healthcare without being connected with the people who experience it, patients and families and their caregivers, because they have the answers. What do you want people to take away?
You can only do it when you bring all those key people together, and this conference actually did that. From its inception right through to presenting the conference, everybody was involved. It was a true co-creation. And so it models what we are aiming to do in healthcare.
Well, welcome back to the office, Jodeme. Give me a sense of how the conversations have been going.
It was incredible to talk to everyone and to hear from them how they would measure success and what would make them proud. And it all came down to the same fundamental principles. The fact that we're co-designing the answer for improvement, which they feel is unique, and they think it's the most important area of focus to bring to integrated care. Tell me your thoughts.
Very excited about this. We have been attending lots of different conferences on integrated care, and one of the things we really felt needed to come to the conversation was the perspective of patients and family caregivers.
The first ICIC conference in North America is where we'll see innovation and inspiration from many perspectives, from research to policy, to patient and caregivers, and through to clinical practice, and how it all comes together to realize the potential of integrated care.